Hi guys, I'm Josh McCullum. I'm one of the osteopaths at Good Health Centre, Street Lane in Leeds, and I just wanted to very quickly speak to you about insertional versus non-insertional Achilles tendinopathy. So a lot of people have heard of Achilles tendonitis. In reality, as you might have seen in the previous video, it's a tendinopathy now, and it's a spectrum of where it goes from inflammation to degeneration and kind of just fluctuates between. But essentially you can get insertional, which is where it attaches onto the calcaneus, and you can get non-insertional, which occurs between 2 and 6 centimetres above. A lot of the symptoms for Achilles tendinopathy are quite apparent in terms of you may feel the pain exactly where it is and you can physically press it. It's quite a palpable pain. There may be a lump in the area. It's usually a little bit worse after rest when you first start to use it. It can then get worse as you go through extensive exercise. In terms of things that may lead you to potentially getting the Achilles tendinopathy, we need to look at things like medical history. So again, we've previously discussed the fact that medication could be a potential predisposer to it. So if you are on steroidal medication, it can potentially weaken the tendinopathic structures. If you've had a steroid injection or steroid medication. If you've got diabetes, it can be a component. If you are overweight, it can potentially lead you to be a little bit more predisposed to Achilles tendinopathy. If your biomechanics aren't right, so if you're wearing footwear that isn't necessarily appropriate for your format of walking. There's been quite a lot about overpronation over the years where your foot drops too much every time you walk. And yes, there is merit in that, but it's not the be-all and end-all of fixing Achilles tendinopathy. And then the only other thing I want to talk to you about is the fact that insertional Achilles tendinopathy does tend to heal slightly slower than non-insertional. And the reason for that is there can be other structures at play. So you can get like a bursitis near the Achilles tendon that could cause it. It may be because of bone spurs coming out of the calcaneus. It may be because there's more arthritic change going on around the ankle that needs to be addressed as well. And the other thing is the blood supply. So the lower down the tendon you get, generally the blood supply gets a little bit worse. And as the blood supply gets that little bit worse, so does its healing potential. It just takes a little bit longer. And that's where you really need to work with your physiotherapist, with your osteopath, to make sure that you get on top of the Achilles tendinopathy so it doesn't become chronic. And if it does become chronic, as you've seen in the previous couple of videos, there are options for it. So you have still got the option of things like focal and radial shockwave therapy to really target it. You can find that the focus shockwave is a little bit better for insertional. Radial shockwave can be just as good for non-insertional. Focus shockwave, most people tend to find hurts a little bit less than the radial. But yeah, both are going to be good if you're in that chronic stage of tendinopathy. And as well as addressing the other factors, your nutrition, your sleep patterns, your hydration, your biomechanics, all those features, then actually getting some TLC for the area.